Joining us on the program today, everyone. A disturbing video went viral recently, allegedly showing emergency staff at the Federal Medical Center in Abuja refusing to attend to a patient in critical condition. The reasons captured on tape were no gloves and no male attendants available. The footage triggered immediate public backlash and concerns about the state of emergency care in Nigeria's public hospitals. In response, FMC Abuja released a preliminary statement claiming the facility had adequate supplies and equipment on hand and that an internal investigation ordered by the Minister of State for Health is now underway. But beyond the press release, what really happened in that emergency room? And how does a hospital with a world-class procedures like open heart surgery end up facing allegations like these? Let's bring in Dr. Mufta, who's head of clinical services at FMC Abuja. Thank you, doctor, for joining us.
Thank you very much. Thank you.
Let's begin with some clarity. The hospital says gloves and supplies were available, but the video shows staff explicitly citing the absence of gloves as a reason not to act. How do you reconcile that with your internal findings?
Thank you very much. That's quite disturbing. As soon as the video was released, we quickly did an internal assessment, and our quick check revealed that we have adequate supply of medical consumables. In addition to that, we are not short of transfer equipment like this, as well as stretchers, emergency, and our resuscitation materials are also available in excess. So the issue of availability of medical consumable or non-availability is not an issue. So that is not what we found. So that is not, it cannot happen in FMC. An hospital that is doing open heart surgery, that is doing laser surgery, that is doing kidney transplantation cannot be in source supply of simple medical consumable like glove.
Is this an isolated failure in procedure, or a deeper issue of staff attitude and emergency culture? What's your honest assessment of this behavior we saw in that clip? Because that's literally how people die in Nigeria.
Yes. In the hospital, the management headed by Professor Ahmed does not condone a poor staff attitude. So that is where, if you check everywhere, all the walls, all the rooms, everywhere in the hospital are dotted with phone lines, about 4 or 5 phone lines for patients to complain at any point in time, 24/7. So, and some of us don't even sleep up to 2 or 3 hours because we are open to any complaint by the patient all the time. And again, there is QR code also dotted in the hospital for patients to quickly scan consent if there is any, as well as email and the other platforms that the patient can complain. So we don't joke with a patient satisfaction and feedback from the patient. So it's an isolated incident, and the federal government has directed that we carry out full investigation, so which we have commenced, and any staff whatsoever who is indicted will face the full weight of the law. We will invoke the civil service rules to deal with the situation.
The challenge with this, Dr. Mufta, is that it is not the first time it's happening. So I just found a tweet online from one Jonathan Elendu. And here's his own account. It says, June 9th, 2024, I brought an accident victim to the same FMC at about 8 p.m. I got the same treatment as this gentleman. One of the doctors told me she'll abandon the patient because she did not like my attitude, and she walked away. A nurse asked me to beg the doctor. End quote. Does this bother you?
We don't say it can't happen, but I know that since the federal government passed law or regulations that none of these hospitals will reject any emergency, since that time up till now, our hospital has not rejected any emergency cases. So as I speak with you, any case that is brought at any point in time, we must create space for the patient. So whether we're going to transfer patient to the ward immediately, whether we are going to do anything that we need to do, we must create. Even the unknown patient, we have cause to take care of the unknown patient, unconscious patient, and safely transfer the patient back to their relative over time.
Walk us through the protocols that exist for attending to critical cases when a patient arrives unconscious or in distress, especially if the agenda requires specific staff to assist. Should no male attendants ever be a valid reason to delay emergency care?
No, not at all. So as soon as the patient is brought into our hospital, there are 4 emergencies in our hospital which operate independently. So there is surgical emergency, that is accident and emergency. There's medical emergency unit. So there is a gynae emergency unit as well as emergency pediatric unit. So they operate independently. As soon as the patient is brought in, especially into accident and emergency, the patient is quickly taken into the resuscitation area after the triage. So, and the resuscitation commences. So as soon as the patient is stable, the specialist team is now invited to take care of the situation. So, and that is what is done elsewhere. So we don't joke with emergency situation care in our hospital. So this is probably an isolated case, and the investigation have started fully, and nobody is going to be spared if found culpable. It's going to face full-scale civil service regulations.
So you have said repeatedly that investigation is ongoing. Will the outcome include disciplinary action for anyone found culpable? I think you mentioned yes, but will the public get to see that report?
So definitely. I mean, we released a preliminary report, and we promise that the report is going to be made available to the public. And we're going to follow the due process, strictly the public service rule, up to the letter. I mean, so that nobody will doubt the process.
Before I let you go, Dr. Muftar, public trust has taken a hit here. What steps will FMC Abuja take going forward to rebuild confidence, not just with equipment and facilities, but with the attitude and responsiveness of your frontline staff?
Okay, thank you very much. We continue to train our staff. FMC is a teaching hospital. Our 3 core mandate of provision of service, research, and training will continue. So regular training will help the situation. And that emergency unit is also training a lot of staff. I mean, from not only surgery, even from family medicine and other departments that rotate through emergency. In fact, we receive supernumerary residents from elsewhere within Abuja and outside Abuja. So training, apply stick and carrot. I mean, a lot of staff have been commended for their. So while the hospital have also disciplined staff in the past for not behaving well.
Dr. Abiyoku Muftar is head of clinical services at the FMC Abuja. The hospital is under public scrutiny following a viral video showing a man critically ill being ignored by some staff members. Thank you for joining us on the program this evening.
Thank you very much. Thank you.